Just to give you an idea how the oral appliance works, so for example, these are models of somebody, and the general position of the teeth is the upper teeth just overlap the bottom teeth. Now what happens is the airway at the back of the throat gets blocked. With the oral appliance, which I will demonstrate to you in a minute, what we do is we move the bottom jaw forward like that, and then what happens is when the bottom jaw moves forward, it drags the tongue with it into the forward position, and in that way opens the airway at the back of the throat. So that's where the person's normal position is, and now I'm going to demonstrate to you what the oral appliance looks like. So basically the oral appliance is divided into two parts. There's the upper part and there's the bottom part, and then if you look at the sideways, there's a little bar over here, and what we do with special screwdrivers, we can actually titrate that. What titration means is that we can actually move this part of the appliance, and then what that does is it causes the bottom jaw to go forward. Now we do have to be a little bit careful, because we don't want to push the jaw too far forward, because what's going to happen is that the joint over here, the temporomandibular joint, which enables a person to open and close and move sideways, if we stress that joint too much by moving the jaw too far, the lower jaw too far forward, we're going to cause damage here. So what we generally do is we begin in a position where we only move the jaw a little bit forward, and then we have a technique where we can gradually move the jaw forward until the patient gets to a position where they can go as far forward as possible without causing damage to the joint. If we find that we've gone too far forward, we always have the option of moving them backwards. So this is not guesswork, this is very precise, exact work, and we get a great result. Now in terms of wearing this appliance, each person is different. If we find that, for example, we do a sleep study and we get the results that they have obstructive sleep apnea, and then subsequent to that sleep study we possibly determine that they've either got enlarged tonsils or adenoids, or they've got a blockage in their nose, and that is subsequently repaired by the ear, nose and throat specialist. We then do another sleep study, and if we find that the results have improved, then the patient does not have to wear the appliance anymore. However, generally most of the time it is due to either a person having a very large tongue and not enough space for their tongue, and also people who tend to be overweight, and especially obese people. And while it's easy to say somebody to lose weight, it's easier to say that than to do it, and some people just simply cannot manage that, and for them an appliance such as this would be mandatory to wear for the rest of their life. So each person is assessed individually, and this is actually a lifesaver.